If you could go to the doctor and wait almost no time to be seen, have the doctor on speed dial, and also not have to deal with insurance paperwork, you'd say, sign me up, right? Well, today we're here at Boonsboro Direct Primary Care, and that's kind of what you guys do. Dr. Anderson is joining me to tell me more. And Dr. Anderson, what makes your practice here different from those traditional practices where you go in the waiting room, you wait with all those other sick people, you deal with all the insurance paperwork and the payment and all the confusion? Why is this so different and so much better?
Well, because we cut those things out. That's really what it is. Every doc starts with the plan of looking at the patient first and putting that first, and things have gotten very complicated in the recent past, and I decided to cut those things out, and so we can focus completely on patient care.
So how does it work exactly? Because obviously there has to be some payment at some point of the line, so how do people, sign up for this type of program?
So you just do it online, and it's a monthly fee. And it's kind of like Amazon Prime for your health, and you just get charged one thing every month, and we take care of you as often as you need. It's like a buffet, like everything's included.
So if people want to come 30 days of the month, they can come see
Yeah, if you want to see me that often, you can.
Become best friends. And then people also can reach you email, text, call, almost any time of the day. So that's really a huge selling point, is that you don't have to spend hours on hold trying to get a hold of your doctor, because you're really readily accessible.
Yeah, and that was really important to me, because if you have a problem and you want to talk to the doctor, then you want to talk to the doctor. And for it to be such an issue in the typical doctor's office affects patient care and affects their health. And so I made myself very accessible. So when somebody signs up, they get my cell phone number, they get my direct email, and they can call me or email me or text me, so we can keep little problems little, and it doesn't blow up into something big.
Yeah, and that's almost unheard of in this day and age. So that's really excellent. And what made you want to start this? I mean, where did you see the problem with the traditional healthcare system and decide to make a change?
So when I started residency, that's when things were first changing in healthcare nationally, and it got harder and harder to spend time with patients and to really focus on everything that they had going on. We started with lists this big, and then they worked to this list this big, and they just got smaller and smaller until we got to talk about one, maybe two things in each visit, and that's not what patients need. They don't get sick one little thing at a time. And so I just kind of got frustrated with that, and so I made a little change, and that didn't cut it, and so I made a big change, and I ended up here. Patient and doctor interaction is about 9.2 minutes nationally for a family doc. We are about quadruple that at 37 minutes, and so with that extra time, lots of extra time, we're able to get through everything a patient needs. And if they need longer than that, we have longer than that. And so we can get through everything, and then we can get to some of those interesting things that also affects patients' health, whether it's their hobbies or even their grandchildren and goals that they have for getting healthy or staying healthy.
That's so interesting. And so who do you see most often? Who are you really passionate about taking care of? Who really benefits from this type of care?
So who benefits from this type of care? Anybody who has ever, in dealing with their doctor's office, thought to themselves, there's got to be a better way. That is the people that we are reaching out to.
Everybody raises their hand.
Yeah. And so as far as like which patient types we see 5 days old and up. So if a baby's born, we'll see them the next week. And I worked with a geriatrician for a while here in town, and I really became passionate about that population. So I like that population a lot. I also did a little sports medicine on the side in residency, and I like that stuff too. It's kind of a medical hobby.
Yeah, and so like for people who are senior citizens, they might have a lot of different things they need to be keeping track of, and they also might not want to be going to a doctor's office if their immune system's compromised, things like that. This is really an ideal situation.
Yeah, so if you go to a typical doctor's office, you're 100% guaranteed to be sitting in the waiting room with somebody that is sick. Yeah. We didn't even build a waiting room. And so people come straight back, and you don't sit there in this milieu of infection. Yeah. And so that was all by design.
And then what about people who, they're already paying for healthcare, Medicare, things like that? Why should they still consider this option?
Good question. So they can stay healthier. Yeah. If they have direct access to me, then if somebody is sick over the weekend, they call us Monday morning, we can get them in Monday afternoon or Tuesday morning. And if it was a chest cold, we can get it while it's still a chest cold. Yeah. Versus where things used to be different, and the typical practice where they'd get them in on Friday. And then it's transitioned to a pneumonia, and then you have all those problems, potential of hospitalization and things like that. So we can keep little things little before they get to something bigger and more dangerous.
Well, if you want to make a positive change for your health and sign up for Boonsboro Direct Primary Care, they're located here at Peakland Crossing on Boonsboro Road, right next to the Kroger in Boonsboro. And for more information, you can give them a call at 434-214-0722 or visit BoonsboroDirectPrimaryCare.com.